So, yeah, thank you, Bill. And
Tell them what you do.
yeah, I'll tell my story. And it's really an honor to be here today on Cancer Prevention Day. Thank you to everyone who's joining. And I want to tell a story about something I'm passionate about, which is prevention of cancer in people with HIV, and also give a global health perspective on cancer prevention. So really one of the great biomedical victories of the past 20-plus years has been the development of effective drugs to treat HIV. And with increasingly effective and less toxic drugs, patients living with HIV now have a lifespan, a life expectancy comparable to that of the general population. But with these victories, cancer has become the leading cause of morbidity and mortality in this patient population. And for the more than 1.2 million people with HIV living in the United States and 37 million people living with HIV globally, cancer is an important issue that we'll need to address moving forward. So in terms of cancer prevention, there are actually very effective methods to prevent cancer in this patient population. We've known for many years that lymphoma, Kaposi sarcoma, lung cancer, liver cancer are all occurring at increased rates, substantially increased rates compared to the general population in people with HIV. Additionally, cervical cancer and anal cancer and cancers caused by HPV are increased in this patient population. But fortunately, there are effective ways to prevent these cancers, and that's what I want to talk to you about a little bit today. So first and foremost, the most important thing you can do to prevent cancers in people with HIV is starting them on antiretroviral therapy early. This is a proven way to prevent lymphomas and Kaposi sarcoma. And we know that by early antiretroviral therapy, we can decrease cancer incidence by more than 50%. And so rollout of antiretroviral therapy, access of antiretroviral therapy to the more than 37 million people around the globe, and the tremendous efforts to do this need to continue. The goals of reaching 90% of people with HIV and providing them with effective antiretroviral therapy will not only curb the HIV epidemic, but for the people living with HIV is an effective and proven cancer prevention strategy, and we need to keep pushing forward with these efforts in the United States and globally. The second area where cancer prevention has proven to be effective is in the area of HPV-associated cancers. And we heard a little bit about this during the lunch session, and I just want to expand on it a little bit more. So both cervical cancer and anal cancer, as well as some head and neck cancers, are caused by a virus called human papillomavirus. And we know that vaccines can help prevent HPV, and for young generation, broad use of HPV vaccine holds the promise of perhaps a generation free of HPV-associated tumors. But for more than 37 million people living with HIV, cervical cancer screening and anal cancer screening are proven and effective programs that we need to continue. Decades of cervical cancer screening in HIV-infected women has actually been a major success story in cancer prevention and has prevented a large number of cervical cancer cases in the United States. For the more than 37 million people globally, we really need to look at novel cervical cancer screening methods. And we, again, heard a little bit about this from Vic during the lunch session of how to incorporate things like HPV viral testing into cervical cancer screening programs. And this will be very important globally. Additionally, anal cancer is an important cancer in both women and men who are infected with HIV. The rates in the United States are similar to cervical cancer rates in low and middle income countries globally. And there are efforts to try to develop screening programs for people with HIV that are based on the very effective methods that are used for cervical cancer screening. The National Cancer Institute is sponsoring a large randomized control study called the ANCHOR study, which will look at anal cancer screening and see whether or not anal cancer screening definitively decreases the incidence of invasive anal cancer. And this is a very debilitating disease, and data from this study will be very important in defining prevention of anal cancer moving forward. So the next thing I wanted to talk about a little bit is to put this in the global health perspective. So we have all been touched by someone with cancer. I've been very moved by some of the stories I've heard today. But it's important to recognize that 70% of the cancers in the world today are seen in low and middle income countries. There are 17.5 million cancers per year now, and that number's expected to grow by 70% over the next 2 decades. About a quarter of these are in low and middle income countries are caused by viruses. Working now with the Fred Hutch Cancer Research Center and Global Oncology to conduct research to try to better address the growing burden of cancer in low and middle income countries, and prevention will play a major role in that. The major efforts that we're doing are based on a decade-long partnership with the Uganda Cancer Institute, which is in East Africa. This is a famous cancer institute because that's where Burkitt lymphoma was originally described, and the research that we're doing there will hopefully lead to novel early detection and prevention measures that will build upon the already established efforts to prevent cancer in people living with HIV. And this is particularly important in sub-Saharan Africa, where there are 25 million people living with HIV, and many of them are on effective antiretroviral therapy. So I guess just in closing, I want to thank all of the congressional representatives who are here today and who support cancer prevention and who support the NIH. I think sustained support for cancer research is really what makes these type of interventions possible and provides the evidence we need to effectively prevent cancer. So thank you.